Good morning and welcome to Morning Vibe. My name is Remmy Majala and thank you so much for joining us this morning. Today we are on, well, health and wellness rather. A very interesting conversation we're having today about obstructive sleep apnea. And we have a guest, a doctor who is so suitable for this conversation and would love to know your thoughts on this, because we're going to, of course, dive deeper, not just into the aspects of what, technically what it is, but how it, naturally affects you, at home, how you deal with it. If you have, of course, partners or friends who snore, you do want to tell them to tune in, because this is that conversation that you want to be a part of. So we do have a question for the day today, which is, how annoying is snoring? Did you know it might be a sleeping disorder? How annoying is snoring? And did you know it might be a sleeping disorder? Of course, get us on our social media handles, on Facebook at K24 TV, on X at K24 TV, and of course on our WhatsApp line, which is right there on your screens. Would love to know your thoughts. It's going to be a very interesting conversation, I can assure you on that. And of course, let me introduce our guest for this morning and this conversation. We do have with us Dr. Ian. Thank you so much for joining us.
Asante.
He is an ENT surgeon, and he is so well versed in this. We just had a conversation, right before this, and he's here, of course, to tell us more about what sleep apnea and specifically obstructive sleep apnea is. Dr. Ian, thank you so much for coming to our set today.
Asante sana, Remy. Thank you so much for having me.
Oh, you're welcome.
Yes. So, sleep apnea.
Yes. Actually, before we even go deeper into that, tell us exactly how an ENT surgeon is connected or well versed into matters talking about, sleep apnea.
Yeah. So, an ENT surgeon. So I'm an ENT surgeon. I deal with the ear, nose, and throat. Yeah. And we get to see a lot of patients who snore. So I started asking myself what is happening and what can be done about it. And we see this both in children and in adults. So children, we do a lot of the surgeries, remove the tonsils, the adenoids. Right. But lately I've been seeing a lot of adults who snore. And so the question was, is it a problem and what can be done about it? And that's when I delved into and found out that actually snoring can be a sign of obstructive sleep apnea. And that's how ENT surgery are one of the people who deal with sleep apnea.
I hear you.
Yes.
So in a layman's way, how would you explain what sleep apnea is? Okay.
So we already know what snoring is. Yeah. Snoring is that sound that you make when you fall asleep. Okay. So that one, we are all versed with it. About 30 to 50% of people may have snoring episodes throughout their life. So usually the snoring is a social issue, but then our worry is it a sign of obstructive sleep apnea? So what is sleep apnea? It's this interruption of breathing at night. So you go to sleep and you find that the breathing pattern actually changes. And it's not like asthma. Patients always are worried, is it asthma?
Yes, I can see how they can be related.
No, it's not asthma. It's interruption of your breathing pattern at night, okay? And what actually causes it is you get a collapse of your throat tissues. Wow. So the tongue falls back. Yeah, it is. It has a whole lot of health problems, but you have like collapse of your throat tissues, your tongue falling to the back, and then that collapses. And that brings three problems. Number one, your oxygen goes down.
Wow.
Number two, your carbon dioxide rises. And then number three, you get micro arousals that you don't notice. And this can happen hundreds of times throughout the night. So your brain is having a micro arousal and you're waking up feeling tired, you get morning headaches, you get sleepy during the day, and of course you also have the snoring episodes.
Wow.
And it's a big problem right now, and we're seeing it more in men and a little bit in women. Of course, we know more men snore than women. Yeah. And it has a lot of, and the reason we got worried about it is two reasons. Number one, it affects your sleep quality. And then number two, overall health problems.
I see.
And we can delve into that, yeah.
You know, while I was reading about it, I saw that men over 40 especially, you know, go having this particular, you know, aspect. Why is it exactly that?
So actually, so the reason for that is men gain weight up here, okay?
Oh,
so it's very interesting. Ladies, when they do gain weight, they gain weight around the hips. Men gain weight up here.
Right.
Okay. So remember.
So you mean from the tummy to the chest?
From the tummy upwards, yes. So what happens? The neck also gets a lot of restrictions as well. So at night, you get less airspace, and that's what collapses.
I see.
And when we think about it, remember, what are the signs? Snoring.
Yeah.
The other sign is getting tired or feeling sleepy during the day. And usually when the patient comes, they come with their bed partner. And when I say bed partner, have you ever witnessed this guy obstructed or choking at night? Or, you know, what they usually say is that they snore and then, you know, it's like when a stuka, you know. And then also high BMI, you know, so sometimes uncontrolled blood pressure, uncontrolled diabetes. We also ask, have you ever tried elbow therapy, you know, trying to wake this guy up to try to sleep on his side?
You mean it's called elbow therapy?
Yeah.
Not just nudging you to wake up, but hey, elbow therapy.
Well, that's what I call it. I call it elbow therapy, where you wake him up. Yeah. So those are some of the signs and symptoms, yes.
That's interesting. You know, we've had a culture in the past where we don't have, you know, most, you know, people going to do checkups. So most of the time they may not diagnose something in the correct way. They'll just be like, you know, I've just been having this issue. I think I need to exercise more. I think I need to do this. But it's not really what they're supposed to do. It's just what they think that they're supposed to do. So have you been having cases of more people coming into you and saying, hey, I have a problem and I think it may be sleep apnea? Are they cognizant of that?
Yes, actually. So we have to be very thankful for the wellness movement.
Okay.
So there are 4 pillars of wellness. Number 1 has been exercise. And we've had gym guys exercise. We're currently in the Olympics. You can imagine, we've talked about exercise all our lives, okay? Then the second, so that's movement of your body. The second arm of wellness is nutrition. And we have nutritionists, they're specialists talking about nutrition and all that. The third arm of wellness has just come up, that is mental health.
Right.
The fourth arm of wellness has been totally ignored, that is sleep. Actually, sleep medicine as a specialty is one of the newest specialties in the world, about 30 years old. That's very new for a specialty. So out of those, now that's where, like what you're asking, are guys coming, finding that out. So it helps because of wellness. Then number 2, the diagnosis bit of it, because we do get a lot of people coming into the sleep and diagnostic center, and we diagnose them with all sorts of sleep disorders. There are some machines that we hook up to them, and it tells us a whole bunch of things, you know, from the stages of their sleep, limb movements, breathing movements. And because there's this new age thing of asking about sleep, then stages of sleep and stuff like that. Am I sleeping well, guys? People want to be 100%.
I see. Before we even dive deeper into that, Dr. Ian, I just like to remind our audience of our question of the day, which is how annoying is snoring? And did you know it might be a sleeping disorder? How annoying is snoring? And did you know it might be a sleeping disorder? Annoying, you know, sleeping, I mean snoring because, well, most of the time, most people will be like, my partner snores, or I'm not having it. But you see, it might be a deeper thing that you may not understand, and so we just want to get your thoughts on that. You can get us on our social media handles. On Facebook, that's at K24 TV. On X, that is at K24 TV. And of course, get us on WhatsApp. The number, you know, was right there and will be put right there, you know, back on your screen. So, Dr. Ian, one thing I'm curious about is we joke a lot about sleep before you go into now the other aspects that people may be interested in knowing what sleep apnea is. We joke about sleep and you say, we sleep when we're dead. Because
Yes.
we have so much work to do. And of course, in the times we are living in, people are doing so many other jobs and there's a lot of stressful conditions. So why does anyone want to consider sleeping? They're like, I don't want to sleep. I want to work till I drop. And unfortunately, in some instances, people actually do drop.
Yes,
And
yes.
they never get back up. So what is your perspective on that? Like, how are you able to talk to someone and tell them, hey, I know life is insane, but you have to sleep.
Okay, okay. So think about it. There are 4 states. There is wake, there's sleep, there's unconscious, and then there's death. So what we're talking about is the second one, sleep. And scientists actually don't know why we sleep. We do know that it restores your brain, it restores your muscles, it restores a lot of your physiology, your function. And the crazy thing about sleep is that everyone thinks it's one big block, but that's not true. You go through 4 stages of sleep. You go through 4 stages. You go from awake to light sleep, then you go to deep sleep, then you go to what we call REM sleep. Okay, so stage 1, stage 2, stage 3. REM sleep is where you actually dream, and then you now go back to light sleep, deep sleep, REM, and you do that about 4 to 5 times in a night, about 2 hours for all those stages.
I see.
And when we go through those stages, the dream stage is fascinating. Of course, we're not able to see dreams. We can only recall our dreams.
Yeah.
And what we think, how we sleep is the fact that the deeper you get into sleep, the more restorative it is.
Yeah.
And that's why sleep apnea is so dangerous, because we are getting micro arousals and it's not getting us into the deep part of sleeping. So you wake up and you're feeling really tired, you've been snoring the entire night, your bed partner has not slept as well, and you don't get into that deep part of sleep that you really require. Now, everyone is always asking, hey, what about dreams and all that stuff? And the thing that happens is dreams are the day's residue. It's something that we call the days. So what we dream is a lot of the things that have happened during the day, and a lot of things that we are thinking about for the future, and then sort of planning. Okay, so what we think is it's also a planning function, and it's like a personal psychotherapy as well. It's very interesting.
Dreaming
yes,
is psychotherapy.
Yeah, yes, because when you do sleep, you feel better. Our parents were actually right that make a big decision after you have slept, because it's at the back of your head, and you may have some of the day's residue sorted out as you sleep as well. It's very fascinating.
That's clear.
Yes, yeah.
When you say it that way, that's very clear.
Yeah.
You know what, Dr. Ian, we have some feedback, you know, from our viewers, you know, on Facebook, where you have to say, like you said, you know, some of you are asking, I hate people who snore.
Yes.
You know, they're asking, I hate people who snore. Okay, we understand, but you know, Dr. Ian here has explained that they may not know why they're snoring. They just find themselves that, you know, they're in a particular state, and he's explained that very clearly. We get you, we empathize, you know, really sorry about that, but yeah.
So there are 2 other steps: to diagnose and then to treat it. So how do we diagnose something that you may or may not be aware, or it's your bed partner that has an issue with it? So we do 3 things. Number 1, we take a history. Come to the clinic, come to the sleep center, and we take a history. Usually we like the history with you and your bed partner, because it really helps. And we find out what could be happening, all those things, your day symptoms, your night symptoms, find that out. Number 2, do a physical examination, check from your nose all the way down to your voice box.
I see.
And then number 3, we do a sleep study. And the sleep study is what now checks. It checks your brain patterns when you're sleeping, the stages of sleep that you're in, how loud your snoring is, how you're breathing, obstruction, how the chest and abdomen is moving, chin muscles, leg muscles. And the reason for that, we do that is there's a part of sleep, your REM sleep, where actually your muscles become what is called atonia, where you can't move. And the reason for that is very interesting, because if we can move, your body can't tell the difference between dreaming and being awake.
Why is that?
Your brain is dreaming like you're being chased by a lion, but your muscles are not moving.
I see.
Because it can be very dangerous if your brain believes that you're being chased by a lion.
But what about the people who sleepwalk? We make fun of them. I mean, in African cultures, even right here in our country, you know, we have the sleepwalkers. You know, they're known and they serve different purposes for that matter. So,
what's
what do you
happening
call
with
them?
them? Yeah, those are called parasomnias. They are certain behaviors that shouldn't happen when you're asleep. Sleepwalking, sleep talking, sleep eating, bruxism. Bruxism is grinding of the teeth, all that stuff. It's an intrusion of wake, of activities that happen when you're awake, when you're asleep. Intrusion, we call it intrusion of wake into sleep. And some of them usually are childhood things and can clear up. And you'll find a lot of pediatricians deal with sleepwalkers, sleep talkers. But then for some people, if it doesn't help, then now you'd now go to a specialist and they'll be able to diagnose and treat it as well if it's really bad.
I see. Just going back to when your muscles don't move, I don't know, is sleep paralysis something that is a connection?
So yes, sleep paralysis is very scary for patients. Because what sleep remember I've told you there's wake and there's sleep, and there's a very clear distinction. So what sleep paralysis is when there's not a very clear distinction between wake and sleep. So you feel like you can't move, you feel like there's a chest pressure on you, and you start getting some hallucinations, and usually it's negative hallucinations. You feel like there's an evil force around you, or what people call demons or stuff like that. And it's for very short, but what patients say, it feels like forever. Okay, so it's usually very short. Short meaning it could be just seconds.
I see.
But you can imagine you can't activate your muscles because there's an intrusion of sleep into wake or an intrusion of wake into sleep. And for some people it's isolated, it's very scary, but for others it's part of a problem called narcolepsy. There are certain molecules in the brain that are not enough, and the treatment for that is some medication, or what you call a CBTI by the psychotherapist.
I see.
Yes.
You know, there are very many people who are experimenting with very many things. Again, I'm relating this to present day life, and they're into different spiritual practices. They are into different ways to just numb themselves, or just to get peace and sleep, like I mentioned earlier. So how do you deal with such matters, you know, where people just impose on themselves different things and then it becomes a physical problem? Yeah,
so I don't deal a lot with dreams because that now is more spiritual. However, God heals in different ways, and one of the ways he talks to us is through dreams. And people do interpret a lot of their dreams, okay? And the thing about dreams, it's very steeped in spiritual context and cultural context.
Right.
And if you have to interpret that through those two lenses. And the third problem is because we can't, in science, if you can't see it, if you can't measure it, then it's very difficult to diagnose, give treatment options. So that's why it's more steeped in spiritual context and cultural context. But I do think that dreams are super important. Some people come and complain that they can't remember their dreams. Not everyone remembers their dreams, but dreaming occurs in REM sleep, and if we find that there's a problem with REM sleep, then we try and sort it out.
That is so interesting.
Yes, it is.
You know, with all those things, I'm imagining, and also so that it has a lot of risk factors.
Yes.
For that matter, you know, to the extent of death.
Yes.
You know,
yes,
if you're not able to get, you know, your proper sleep and the like. You know, just give us a bit of those risk factors associated with sleep apnea.
Yeah. So remember, what we require is good sleep quality and good sleep quantity. Most people are worried, am I getting enough sleep, the 8 hours of sleep? But think about it, you might sleep 8 hours, but you're not getting the good sleep quality.
Yeah.
So what are the effects of that? You know, you have cardiovascular issues. Remember what I said? Your oxygen goes down, your carbon dioxide goes up, and you get microarousals. So you're not getting enough oxygen. So that already tells you your heart health, your lung health, your brain health, hypertension, even dementia as well.
Wow.
You know, yeah. And then just activity during the day. If you're not getting good sleep, then that means your day activities are affected. So especially truck drivers, taxi drivers, and then what we call mission critical actors. So mission critical are military guys, security officers, medical people as well, you know. That's mission critical, yes, yeah.
I hear you.
Yeah.
I mean, that sounds very, you know, key into how then we will live. Then this, let me not call it a disease. I think it's a thing that comes about. I don't know. Am I right not to call it a disease?
No, it is. It is.
It's a disease?
It's a disease, and it's actually classified by the International Classification of Diseases.
Wow.
Yes,
okay.
ICD-10 has classified sleep apnea as a disease. So
Right.
that's why now we can offer treatment options.
And is it genetic?
Yes, we do see that sleep apnea can run in families as well. Yes, yeah.
I mean, how is that even? I mean, because it's a sleep thing. So how do you get that from genetics? I want you to make that clear.
Yeah. So unfortunately, genetics is one of the hardest things. So in genetics, 1 + 1 is not equals to 2.
Yeah.
So you can find that your father may have sleep apnea, but you don't, and then your child does. So it's not 1 + 1 = 2, but usually there's a risk, and usually it's usually between 18 to 30% risk of having, if your parent has obstructive sleep apnea, then there's a risk that you may have it, but it is not 100%.
I see.
Yeah.
So the people who have like, you know, day, you know, sleepiness, you know, they're very moody.
Yes.
Sometimes, you know, they're depressed and stuff like that. Do you suggest that, hey, maybe come for a checkup, we may be able to see or diagnose if it's what we think is sleep apnea?
Yes, so you're very right. Feeling tired, fatigued during the day, what we call excessive daytime sleepiness, and also mental stressors as well. We do know that anxiety, depression, all can affect and are affected by sleep disorders, and particularly sleep apnea as well.
I see.
So we ask those guys to come in, we have them get checked, and we can tell, hey, actually, if sleep apnea is a problem and you're snoring as well, then we sort it out. And a lot of people actually, unfortunately in women, it may not present as straight up snoring. You may have what you just call mood disturbances, a lot of body aches. You know, you're just not feeling like you're sharp as you used to be. That could actually be sleep apnea as well.
Interesting.
Yeah, it's very fascinating.
All right. Okay, Doctor, and we'll be right back, of course, with more of this conversation. We're taking a short break, but stay tuned. It only gets interesting. We'll be back after the break.